Hi, this is Carla, and this is my psychological evaluation of Devi Vishwakumar from the Netflix show Never Have I Ever. Psychological intake assessment. Current residence of the patient Devi Vishwakumar, a 15-year-old female, is currently in the San Fernando Valley of Los Angeles, California. The patient's family history. She states that she has lived in the San Fernando Valley since the beginning of her life with her parents in Sherman Oaks, Los Angeles. The patient has stated that she was born and raised there as well. The patient states that her parents Nalini and Mohan Vishwakumar came from Tamil Nadu, India. The patient also states that she recently lost her father due to a heart attack and that he died right in front of her while she was playing her heart at her orchestra concert. The patient has stated that she has a very distant relationship with her mother since then and a little bit before that and misses her father terribly. The patient's school and work environment. The patient has stated that she is a student at Sherman Oaks High School and has two best friends. One of them is Fabiola and the other one is Eleanor. The patient states that she truly enjoys being a top student at her school so that she may attend Princeton University after she graduates. This was a dream that her and her late father had for her. The patient no longer plays the harp due to the instrument reminding her of the traumatic event of her father's death. The social and environmental. The patient mentions Paxton Hall Yoshida, another student, several times during our session. The patient mentions her cousin Kamala, who recently moved in after her father's death and came to further her career in Los Angeles. The patient mentions her cousin is so gorgeous and that it is affair no one noticed how smart she is because of her looks. The patient has also stated that she has romantic feelings for Paxton, but that he is out of her league because she is in the UN, the Unethical Marriage Group. This is something that the school body nicknamed them for because they were just a couple of nerdy girls, outcasts, I guess you would call it. When a patient begins to discuss Paxton, she starts mentioning how she would like an actual romantic relationship with him and she plans for him to be her first kiss and her first sexual intercourse experience. Patient also has romantic feelings for Ben Gross, her nemesis, but Paxton has been her crush since the third grade. Medical issues. The patient stated that she temporarily lost feeling in her legs after the death of her father, but no other medical conditions were reported. She did discuss having seen Paxton one random day while she was still in the wheelchair and she was out with her mother. But when she saw Paxton, she wanted to run to him so bad that she miraculously regained feeling in her legs and started walking again. The symptoms, behaviors, or indicators. The patient has impulsive behavior. She's constantly causing tension and drama in her relationships, especially when she's stressed. This connects to my first diagnosis, adjustment disorder. Avoidance of grief. She refuses to talk about the loss of her father and avoids dealing with her sadness. Anytime they bring it up or every time she has a therapy session, she rather just says that she's okay. This connects to my second diagnosis, persistent complex bereavement disorder. Flashbacks. Triggered by memories of her father's death, she has random conversations with her father, and usually they're just kind of random, in the moment kind of conversations, and she gets really sad after she has those conversations with him. This connects to my third diagnosis, PTSD, post-traumatic stress disorder. She also has symptoms of self-sabotage, anger, and emotional highs and lows. When she self-sabotages, she thinks that she's protecting everyone by making up lies or just behaviors of, hey, I did this for you, or that kind of behavior. So the trust is constantly broken between her friends, her family members, and her potential romantic relationships. Diagnosis number 1. Disorder type trauma and stressor related disorder on page 287. The diagnosis for this patient is adjustment disorder. The specifier is with mixed disturbance of emotions and conduct. The 3 criteria that were met on the diagnostic criteria on page 286. A. The development of emotional or behavioral symptoms in response to an identifiable stressor or stressors occurring within 3 months of the onset of the stressors. C. The stress-related disturbance does not meet the criteria for another mental disorder and is not merely an exacerbation of a pre-existing mental disorder. E. Once the stressor or its consequences have terminated, the symptoms do not persist for more than an additional 6 months. Symptom: impulsive behavior. She's constantly lying, sneaking out, and she's jumping in between relationships just to fill some kind of void that she's missing. Etiology: nurture. The nurture is triggered by her father's sudden death. Etiology support. Quote, adjustment disorders may be diagnosed following the death of a loved one when the intensity, quality, or persistence of grief reactions exceeds what normally might be expected when cultural, religious, or age-appropriate norms are taken into account on page 287. The treatment plan is CBT and family therapy, and the duration of the treatment is planned out to be 6 to 12 weeks. And if it still doesn't need to be resolved, then it will need to be probably extended another 6 months. The prognosis will be more than likely favorable with early intervention, but there is risk of symptoms escalating if they are ignored. Diagnosis 1. Prevalence of trauma and stressor-related disorder. This graph here is a representation of the trends between the years and the percentage of adolescents that suffer from a disorder, depending on depression, anxiety, or like in this case, an adjustment disorder. Between 2016 and 2023, the prevalence of diagnosed mental or behavioral health conditions amongst adolescents increased 35%, and that's from 15% to 20% between 2016 and 2023. The prevalence of diagnosed anxiety increased 61%, that's from 10% to 16.1% between those same years, and depression increased 45% from 5.8 to 8.4. The prevalence of diagnosed behavior conduct problems was stable, and this is in a national U.S. data. Diagnosis number 2. Disorder type, other specified trauma and stressor related disorder. On page 289. The diagnosis is persistent complex bereavement disorder on also page 289. And the specifier is other reactions to severe stress. The 3 criteria were number 5, persistent complex bereavement disorder. This disorder is characterized by severe and persistent grief and mourning reactions. And you can see this on the chapter Conditions for Further Study on page 789. The second criteria that was met was adjustment-like disorders. It's a little similar to the first diagnosis, but this specific diagnosis is just a little bit more elevated as far as the grief portion. The way that she was experiencing seeing her father and that sort of thing. It's just a little bit over the normal grief that other normal people would experience in a sense. And this adjustment disorder with prolonged duration of more than 6 months without prolonged duration of stressor. A. The individual experienced the death of someone with whom he or she had a close relationship. And she did. She was a lot more closer to her father than she is to her mother. They made plans. She was a daddy's girl, what she would say, and everything that she wanted. She always made plans with her father. The symptom is that she avoids grief by lashing out and self-sabotage. And then the etiology is environmental because of the sudden parental loss with her father's heart attack. The support is bitterness or anger related to the loss, the anger over the loss specifically. Some individuals with persistent complex bereavement disorder experience hallucinations of the deceased, auditory or visual, in which they temporarily perceive the deceased's presence, which she did. She had a couple of occasions when she was seeing her father, not like an everyday situation, but she was seeing him on those low moments that she had in her life after he passed. And you can find the support on page 791. The treatment plan is complicated grief therapy and planned out to be once a week for at least 6 months to maybe a year if it's unresolved, and then reevaluate. And the prognosis is that meaningful improvement is likely, but if she is untreated, depression can come into place, considering she'll probably see more hallucinations, or she'll still lash out at her mother for how she feels, lash out at her friends, and sabotage her relationships with her friends and her potential romantic relationships. This is a national data graph of diagnosis number 2, the prevalence of other specified trauma and stressor-related disorders, focusing on persistent complex bereavement disorder. As you see here at the bottom, all the symptoms that come with this disorder, such as longing or yearning, pain, sorrow, or grief, avoidance of reminders, stunned, shocked, or dazed, confusion about the role in life, trouble accepting the loss, hard to trust others, bitterness over the loss, difficulty moving on, numbness, and empty and meaningless. So she does constantly long for her father, but it's not a constant everyday thing. Now the grief is there, but she does choose to avoid it. So with that, she doesn't want to remember how she used to play the harp. She doesn't want to remember that she used to be temporarily disabled. Her confusion about the role in her life is mainly that she thinks her self-worth only relies on being accepted into Princeton University, and that's that, just because she's doing it for her dad. Um, she still does have troubles accepting the loss of her father, and she's definitely still bitter over the loss of her father, as she lashes out to her mother saying that she wishes that she was the one that died instead of her father. So it's still definitely a very fresh wound to her. Diagnosis number 3, disorder type trauma and stressor related disorders on page 287. Diagnosis is the post-traumatic stress disorder, PTSD, on page 271. The specifier is not, there's no specific specifier. Criteria. The 3 criteria. A. Exposure to actual or threatened death, serious injury, or sexual violence in one or more of the following ways. 1, directly experiencing the traumatic event, and 2, witnessing in person the events as it occurred to others. So she did physically see in front of her father dying, and again, directly experienced it and witnessed it in person as it happened. B, presence of one or more of the following intrusion symptoms associated with traumatic events or beginning after the traumatic event occurred. 1, recurrent, involuntary, and intrusive distressing memories of the traumatic events. So she is constantly thinking, having nightmares of how her dad died, or whenever she sees him in her hallucination. D, negative alteration in cognitions and mood associated with traumatic events, beginning or worsening after the traumatic events occurred, as evidenced by 2 or more of the following. So one of them is persistent, distorted cognitions about the cause or consequences of the traumatic events that lead the individual to blame himself or herself for others. And 6, feelings of attachment or estrangement from others. So she is constantly blaming herself about her father's death because she thinks that she was stressing him out with the whole Princeton University dream that they had together and the constant fights that she would have with her mom, and he was always the mediator between them. So she did blame herself for his heart attack because right before the concert they did have an argument. Once again, her and her mother, and at the concert, that's when the heart attack happened and he died. And then the feelings of attachment or estrangement from others. She was already estranged from her mother before the event happened, but it did seem to worsen quite a lot after the event happened. And just reminding that she did say that she wished that her mother had died instead of her own father. The symptom of flashbacks, this is just her remembering when she hears like music, specifically coming from her heart. It's just an instant reminder of the song that she was playing, what she was wearing, and everything to every single detail. The etiology is her witnessing her father's sudden heart attack, which is a traumatic event for an adolescent. And the support, quote, the individual may experience markedly diminished interest or participation in previously enjoyed activities. On page 275, she did stop playing the harp. And individuals with PTSD may quick-tempered, and she definitely lashes out at anything. The treatment plan is family therapy, so that the patient can address her conflicts with her mother. And then trauma-focused cognitive behavioral therapy, so that we can reduce our flashbacks and process the trauma. And the duration of the treatment will be 6 to 12 months, and the prognosis is that the patient is good and will be good with her family support, like talking to her mother, how she feels, opening up. But if untreated, the patient is at risk for chronic PTSD. So constant reminders of the event if she doesn't just talk about it and learn how to live with it in a sense of what happened. And this is diagnosis 3, prevalence of trauma and stressor-related disorders. This is the global stats within a lifetime in different countries all over the world. And this information was found in the British Journal of Psychiatry, volume 209, issue 4. The diagnosis summary for Devi Vishwakumar. So, in our summary, she presented with 3 disorder types, all with different subtypes. So, the first one was the trauma. They were all trauma and stress related disorders, except the second one, which is just a different, elevated, still getting studied trauma and stressor disorder. But the first one was the adjustment disorder with mixed disturbance in emotions and conduct. The etiology of the disorder was her father's sudden death with nurture. And the treatment plan is, again, CBT, CGT, family therapy, and it is favorable with early intervention. The other specified trauma and stressor disorder was persistent complex bereavement disorder. The specifier is other reactions to severe stress. And the etiology was, again, her sudden parental loss, which was environmental. The treatment is complicated grief therapy, and she will likely improve, but if untreated, she is at risk of depression. And the last one, the last trauma and stressor related disorder is PTSD, and this came from witnessing her father's death. The treatment plan is TFCBT and family therapy. And with good family support, she should be okay, more than okay at the end. But if untreated, she is at risk of chronic PTSD. Thank you for listening to my presentation.